Southlanders and football fans everywhere were stunned and saddened this week by the death of 12-time Pro Bowl linebacker Junior Seau. The coroner now has classified his death as suicide, but the big question everybody's asking tonight is why would someone so successful commit suicide?
Yeah, joining us now is Dr. Michael Uszler. He's the medical director of nuclear imaging at St. John's Health Center in Santa Monica. We so appreciate you being here. We also have Steve Hartman. He's going to be weighing in on the whole situation. He knew Seau personally, so we're going to get to you in just a second. First, Michael, if we can talk to you a little bit about just the impact that being in the NFL for, what, 20 years and just constantly being hit in the head, and no doubt he must have had a concussion here and there along the way. How does this connect to having such a depression and possibly committing suicide?
Well, remember that the way your life occurs is really, it requires your brain to work very effectively. And if your brain is not functioning properly because it's been injured, or in the case of what's considered here this chronic injury pattern of multiple injuries time and time again, that the brain actually doesn't ever really completely heal, that although the brain has a lot of ability to overcome and compensate for some things, ultimately someone who's played for say 25 years, and we're talking about high school as well as college and what have, has probably had maybe more than say a few dozen concussions. And we know that brain injury also occurs even at what's been called a subconcussive level. In other words, the way it's injured is that, remember, it's a soft substance, about the consistency of soft butter, and it weighs about 2.5 pounds. And without even striking your head, if your head is accelerated, that 2.5 pounds starts moving. And when your head comes to a stop, your brain sort of stops and bumps into and actually impacts the inside of your skull, which is a very hard structure. Then the brain can actually recoil off one side and strike the opposite side of your skull. In the process of that, some cellular function is disrupted. And if that happens frequently and often enough, as the brain and as your body attempts to repair that, certain proteins are laid down that really don't represent normal brain structure. Ultimately, long-term, what happens, that starts out at the cellular level, in other words, at a microscopic level, with enough injury pattern becomes of a larger and larger dimension, ultimately ending up in what's been called this chronic traumatic encephalopathy.
But certainly there are a lot of football players out there who get a lot of concussions. But why only a handful, so far, that we know of anyway, take it to this step of committing suicide? What is it about Junior Seau that's not the same as dozens of other football players who have had the concussions as well?
Well, first of all, let me be clear. I don't know him personally. I don't know the medical details. He's not a patient of mine. So all I can respond to is what I've heard about in the news.
But why him and not others?
Okay. The answer is that there were clearly some more changes in his brain. Remember, part of the brain, especially the frontal lobes of your brain, really need to be intact so that you can actually show up and be the person that you are. And that includes making judgments about how you would behave or how the rest of your brain is working. So what happens if you damage certain parts of your brain, suddenly your usual capacity to avoid impulsive behavior, your ability to respond cognitively to various challenges, your ability to deal with the fact that you're feeling discouraged or depressed, that gets modified or sometimes impaired enough such that in certain individuals that gets to a magnitude whereby they simply can't deal with the injury pattern that's there. Their brain dysfunction.
And, you know, I've been reading up on it. So CTE, you were just saying, as Rick was just starting to ask a question, I don't know if people heard that. CTE stands for? Chronic
Traumatic Encephalopathy.
Okay. Now, you don't only get depression from this. It can end up with, you know, a variety of other things. It can be Alzheimer's and dementia. Is that correct? I mean, so some of the other players may not get depression, but they may get other things from CTE.
That's correct. In other words, Alzheimer's is its own categorization of dementia, but these players certainly do have an increased incidence of dementia. In boxers, that's been known as the boxer's dementia, not Alzheimer's dementia. But the bottom line is that you end up with, if you get sufficient brain injury in different parts of your brain, ultimately, remember, is that you can only function as well as your brain works. And when your brain doesn't work well, guess what? You don't work very well either.
The hyperbaric chambers, there is some treatment out there if you catch some of the, that you are getting these black spots on your brain to go into a hyperbaric chamber treatment?
Well, hyperbaric therapy is used in the sports world actually for soft tissue healing, muscle injuries, what have you. So it's already present. What's happening is when some of those players are getting therapy, in essence, your whole body is in the hyperbaric chamber. So they are getting some help in injury just from the fact that they're getting therapy for soft tissue injury elsewhere in their body.
Well, we'll see if it helps. Dr. Michael Uszler, thank you so much.
Thank you so much for coming on.
For coming in.
Thank you.
We appreciate it. Thanks.
Yeah, I have a feeling we're going to be hearing a lot more.